Hello beautiful people, welcome back to my channel. Okay guys, today we are going to be talking about implementation station. I'm going to demonstrate how you are going to do it on your OSCE examination day, that you are going to pass your examination. Just make sure you watch this video to the end. At the end of this video, I'm going to share the tips to pass, and the ones you are going to do is going to be a red flag, which is a fail. Make sure you are watching this video to the ending. All right, so guys, let's dive into what we have today. Now, you move over to your OSCE examination center that very day. You have done your assessment and then done your planning. Now is implementation time, okay? So, and then you are sitting just at the side of the door outside the room, because it's just kind of a room. Is in a room you are going to do the implementation. Just everything you need is just by the side around you, all right? You don't have to run around or leave the room and come back and continue, all right? So as you are sitting and your assessor tell you, are you ready? Yeah, you can come in. So you move in. She tell you that your gold, your next station is going to be implementation station. She is going to read the rules of this medication that you are going to abide. Then after that, she will tell you, do you know what you are meant to do on this station? You say yes. All right, she will now say, you can see the clock. All right, so are you ready for this examination, Gold? Yes, please. And then she will say, your time starts now. Immediately, I approach my scene and I see my scene is safe to approach. There's nothing to cause harm between me and my patient. And then I close the doors and the window to provide privacy to my patient. And then I quickly do my hand hygiene with an ample of gel on my palm according to WHO. Palm to palm, right palm over the left dorsal, vice versa. Fingers interlace, fingers interlock, fingers interlock. Rotational lobbing of the tongue, rotational lobbing of the tongue. Tip to the finger, tip to the finger. Rotational lobbing of the wrist, vice versa. I enjoy my hand for 30 seconds. And then I quickly read my scenario. Okay, I put my candidate's name. And then I quickly read my scenario. Okay, it's a 15 minutes procedure. And then my time, date is today and time is 12:00 hour. Okay, so I move over to my patient. Hello. Hi, how are you doing? I'm Nurse Gold. Okay, so I'm here to administer your due prescribed medication. Is there a conference time for you, please? All right, bless you. Please, can you tell me your full name and date of birth? Let me quickly reconfirm that with your wristband and paperwork with me. Hope you don't mind if I touch you, please. Oh, thank you so much. All right, okay. So, your name, please. John Field, okay, John Field, all right, and date of birth 10/2/1950, okay, 10/2/1950, 10/2/1950, and then hospital number is 00425, 00425. Okay, bless you. Assessor, I can see that I have the right patient. Okay, so John, please, are you allergic to medication, latex, food, or dressing, or anything at all? Oh, bless you, you're allergic to penicillin. Oh, so sorry, I can see penicillin, and then you're having penicillin. That's why you're putting on a red wristband. I'm so sorry. What reaction do you usually have when you take penicillin, John? Rashes. Oh, I'm sorry about that, okay? Just to assure you that I'm not going to give you anything containing penicillin diabetic, okay? All right, because it's still the same thing with paperwork I have here. We are aware of it. All right. Okay, John, I'm sorry to ask you, are you in pain? Are you comfortable for this procedure, John? Oh, so sorry you are in pain. I'm sorry, John. If I ask you to score your pain using universal pain assessment tool, 0 being no pain and 10 being the highest, what will you score it, John? 6. Oh, I'm sorry, so sorry, John. Can you take in a deep breath for me, please? Okay, do you mind if I reposition you, John? Oh, bless you. Are you okay? Is that okay? Does it help? How does that feel? It's okay, quite better. All right. Okay, no problem, John. I'm going to check if you have any due prescribed medication that is due on my time. I'm going to administer that medication, okay? And also, I'm going to escalate this to the doctor afterward, all right? Are you happy to bear the pain while I read your prescription chart and bring your medication? All right, thank you so much, John. I appreciate. Okay, okay, quickly. John, let me quickly read the prescription chart. I'm happy. Please, if you don't mind, can you be listening while I read this medication chart with you? All right. Okay, thank you so much for your cooperation. Okay, so John, please, if you need anything, you can ring the call bell. Let me quickly bring my trolley closer to you so you can hear me. Okay. All right, thank you so much. This is the call bell. You can ring the call bell, all right? So I quickly do my hand hygiene again. It's an number of gel on my palm according to WHO. Palm to palm, right palm over the left dorsal, vice versa. Fingers interlace, fingers interlock, fingers interlock. Channel open on tongue to channel open on tongue. Tip to the finger, tip to the finger. Channel open of the wrist, vice versa. I enjoy my hand for 30 seconds. I quickly put on my apron. Guys, in some stations, they are going to ask you not to put on apron to do this procedure. All right, just listen to your assessor. Okay, it's a clean procedure actually. All right, okay, so I put on my apron and my glove. Assessor, please confirm that my trolley has been under lock and care and open for the sake of this procedure. All right, thank you. Proceed. Oh, thank you so much. Okay, so I quickly so sorry to ask again. It has been disinfected as well. Oh, thank you so much. I am happy to proceed as my assessor have said that it's been disinfected within 24 hours and under lock and care. Okay, so I quickly move my trolley closer to the patient. Hi John, I am back again. Okay, so I'm going to read this prescription chart with you while I at the same time bringing out the medication. All right. Okay, John, I'm going to read the prescription chart with you now, all right? Okay, thank you so much. So I have here with me hospital medication administration for John Field. Date of birth is 10/2/1950 and hospital number is 9563810. And then height is 1.68. Is that right? Okay, and weight is 95 kg. Okay. All right, thank you. And then your word is a Maple word and date is today. All right, and then I have here all prescriber must complete the signature record. So and then I have here Dr. BK and then NMC number or GMC number is 7896125. And doctor's signature is Dr. BK and bib number is 2364. Okay, so I am happy that the write-up medication is complete here. So I move over to the next one, still having the same patient detail, John Field. Okay, still having John Field. Okay, still having John Field. Okay, so the last one, I have John Field and date of birth is 10/2/1950 and hospital number is 9563810. Okay, so assessor, I can confirm that I have the right patient. I am happy to proceed. Okay, thank you. So having all prescriber must sign signature and record, which I have read. Okay, moving over to the next one, allergy. My patient is allergic to penicillin and then reaction is rashes. Okay, and then and it has been signed by Dr. BK and bib number is 2364 and date is today. So moving over to the next page, I still have the same patient detail. Information for prescriber is here, and also once only medication prescription is here. The first one is here is date is today, drug is ondansetron, dose is 4 mg, route is oral, and instruction is for nausea. Time required is 12:00 hour, and prescriber signature and bib number is Dr. BK 2364. John. Okay, you are having ondansetron by 12:00 hour, which is due now. Okay, and this medication is for nausea and vomiting, and you might have side effect like nausea and vomiting as well after taking this medication. Are you happy to take this medication, John? Oh, bless you. Okay, John. Okay, so I am happy to dispense the medication. All right, so I proceed to the next one. Still having the same patient detail. Oxygen, prescribed oxygen. There is no prescribed oxygen. My patient is well saturated on A. Okay, moving over to the next one, antimicrobial. Still having the same patient detail. Drug is co-amoxiclav. Date is today. Dose is 6 to 5 mg. Frequency is TDS. Route is pay oral. Duration is for 7 days. Time is 12:00 hour and is today. Okay, John, You told me that you are allergic to penicillin, right? And I can see you also putting on a red wristband, and it's still showing on my book that you are allergic to penicillin. All right. Okay, now I can see that amoxicillin have been prescribed for you. I'm sorry to tell you that I'm not going to administer this medication. Assessor, I'm sorry, I'm not administering this amoxicillin as my patient is allergic to this medication. So I'm going to code it code 6. Okay. All right, John, I'm going to escalate this to the doctor as well to prescribe another type of antibiotic for you. Is that okay? All right, thank you so much. So moving over to the next one. There is no more any other prescribed antimicrobial. So I move to the next page. Regular medication. Drug is paracetamol. Date is today. Dose is 1 gram. Frequency is 4 to 6 hourly and QDS maximum. Route is oral and duration is for 7 days. And time is 12:00 hour. And then this medication is due today. Start date is today. Okay. Finish date is continuing. Prescriber signature and BIP number is Dr. Bikel 2364. Print name is Dr. Kel. Okay. John, paracetamol is due on my time, and you told me that you are in pain, right? Yes. Okay. Thank you, John. I'm going to administer this medication to you to reduce your pain. It's for reduction of pain. All right. Are you happy to take this medication? Yes. Okay, John. You know, this medication is going to cause nausea and vomiting. That is one of the side effects, but it's not a must that is going to happen to you. I just wanted you to know that it might happen. Okay. Are you happy to take it? All right, bless you. Okay, thank you so much. I'm going to dispense the medication after I read this prescription chart with you. Okay, all right. Still moving over to the next one. Lansoprazole. Okay, date is today. Dose is 30 milligram. Frequency is once daily. Route is oral. Duration is for 4 weeks. Time is 12:00 hour. Start date is today. Finish date is continuing. And prescriber signature and BIP number. Okay, I can see there is no prescriber signature and BIP number. Guys, see here, there is no prescriber signature and BIP number, so I'm not going to administer this medication. Assessor, I can see there is no prescriber signature and BIP number for this lansoprazole. So I'm not going to administer it to John. I am going to code it code 6 as is incomplete prescription. Okay, John, I'm going to also escalate this to the doctor. All right. All right, thank you so much for your cooperation, John. Moving over to the next one, I have here metformin, and then date is today. Dose is 2 milligram. Frequency is once daily. Route is oral. Time is 8:00 hour. It's not due on my time, John. So I'm happy to proceed. Okay, and then still having under as required medicine, I have here drug codeine phosphate. Date is today. Dose is 30 milligram. Frequency is 6 hourly. Maximum of 4 times daily. Okay. Route is oral. Duration, there's no time for duration. And then start dates. Oh, and then finish dates. Okay, John, this medication is as required medication, and also this codeine is under 2 nurses procedure. Another registered nurse is going also to ascertain and sign before I can be able to administer this medication, and also I am not yet licensed to administer it. I'm happy to proceed. Assessor, proceed. All right, thank you. Okay, John, moving over to the next one. There is no more as required medicine, John. Okay, move over to the next page. Oh dear, this page. Okay, under the next one, I have here infusion, prescribed infusion, and it has been administered already in 8:00 hour. It's not due on my time, so I am happy to proceed, John. Okay, John, I can see that the medication that is due on my time with you is Administering, which is under once only medication, and also paracetamol. So I'm going to dispense this medication now. Okay. All right, so I'm going to quickly open my medication trolley. Okay, it's open. Okay, and my assessor told me that this medicine is arranged according to alphabetical order. So what I am looking for is Administering, which is O. So I am O. Okay, here is O. Okay, and then I have here Administering. Understeron, okay, 4 milligram, and in the container I am having 4 milligram, and the expiry date is 9/20/26, and then expiry date is 9/20/26. I'm going to dispense this medication and still is intact still, and then I'm happy to administer. So I quickly open it, having my container in the tray. So I'm going to take only 1 tablet out and put it into the container and close it again. Put back in the trolley. Okay, and then moving over to the next one I have now. We are having as required medicine. Yes, paracetamol. Yes. Okay. And then I have here with me paracetamol. All right. Moving over to the P. Okay, here paracetamol. Okay. And then dosage is 1 gram. Okay, and this one is 1 gram, and then 1 gram, and this one is 500 milligrams. So which means I'm going to take 2 tablets. All right, so guys, check out, because sometimes there is paracetamol that is having only 1 gram per tablet, not 5 milligram per tablet. All right, so the one I'm having is 5 milligram per tablet, so I'm going to take 2 tablets. All right, and the expiry date is 25/5/2026. Okay, it's still valid and in fact and still, so I am happy to administer. So I open up this medication, still having another container inside the tray, and then I take 2 tablets. You can take it one so it will not fall out, and another one, and then I cover it, put back. All right, so I don't have any other medication I am giving today. Okay, so I move over to John with my paperwork. Hello John, are you okay? I am back again. Are you still happy to take your medication, John? Okay, bless you. So John, please, can you still tell me your full name and date of birth? Hope you don't mind. I'm going to cross-state that with my paperwork and your wristband. Is that okay? All right, John Field. Okay, I have here John Field, and your date of birth, please. 10/2/1950. Okay, 10/2/1950, 10/2/1950, and your hospital number is 9561010, 9561010. Okay, John, are you allergic to medication, latex, food or dressing, or anything at all? Oh, penicillin, bless you, John. Okay, that's why you are putting on a red wristband. I can see penicillin, and my paperwork is also telling me penicillin. Okay, and what reaction do you usually have, John? Rashes. Oh, bless you. Rashes, also rashes. Oh, I'm so sorry about that, John. As I said earlier, I'm not giving you anything containing penicillin derivative, all right? Okay, bless you, John. So, John, I am back with your medication, and I have a cup of water with me. Please, John, before I give you this medication, can you please take a sip of water for me if you don't mind, so I can assess your swallowing ability? Okay, have you swallowed it? Bless you. Can you do Thank you so much. All right, so John, here is paracetamol to manage your pain. As I explained earlier, you might have side effects like nausea and vomiting, but don't worry, I'm going to come back to check you after 30 minutes of administration of this medication. All right, okay, here, John. Okay, and this is the water. Have you swallowed? Bless you, thank you. And then the next one is understeron here, okay, for management of nausea and vomiting. All right, here, please. All right, this is the cup of water. Have you swallowed it, John? Thank you so much for your cooperation. I appreciate, okay? Can you do for me? Oh, thank you. So sorry about that. I just wanted to be sure that you swallowed it, all right? Oh, bless you, before I can sign, okay? So, John, I'm going to quickly sign now, all right? I'm still around with you, all right? So, guys, quickly open your chart and sign. So, I'm going to sign the one I gave paracetamol here. So I'm going to sign today my signature, okay? And then the next one I gave was understeron, under one's only medication. Yes, here. I'm quickly going to sign it today, and time of giving is 12:00, and my signature Okay, so that is it. And then moving over to the coding one, you are going to code co-amoxiclav because patient is allergic to this medication. Okay, patient is allergic to it. Now you are going to find if patient is allergic to medication, which is here. All right, so guys, under allergy, okay, under the one that patient is allergic to, which is co-amoxiclav, you are going to write code 10 under here. Let me open it again. Under the prescription charts. All right, then when you write code 10 under prescription charts, then you come here, reason for not giving, here, allergy. Patient is allergic to penicillin. You write it here. All right, you are going to write it here. Then make sure you are putting your date. The name of the medication is co-amoxiclav. Dose is there 625, and then route is the oral. Instruction for infection. Time of giving, not giving. Put not giving because you did not administer this medication. All right. So guys, I'm going to do that now. Okay, John, I am done with the signing. Okay, thank you so much for your cooperation. John, I'm going to come back after 30 minutes and reassess you. Okay, thank you so much for your cooperation. Do you have any question for me, John? No question. So in the absence of no further question, I'm going to clear my equipment, ensuring that my trolley is under lock and care. Clear my equipment, put into the clinical waste, remove my glove and my apron. Put into the clinical waste and return my trolley back, and then do my hand hygiene according to WHO. It's an ample of gel on my palm to palm, right palm over the left dorsal, vice versa. Fingers interlace, fingers interlock, fingers interlock. Rotational lobbing of the tongue, rotational lobbing of the tongue, tip to the finger, end of wrist, vice versa. My hands are clean. I am done. Thank you. That is it. You are done. You can see that this station is very simple. And then what are the things you are going to do that is going to be a fail on this station is signing your medication before giving, or signing it when you are dispensing it. Is totally wrong. It's unacceptable because you have not given that medication. Okay, then under the place that they wrote prescriber signature, the first page, you are meant to not to sign it, because some people fail because they signed it before even reading their prescription charts. So make sure you are maintaining the 5 rights of the medication. You can also verbalize it and say, so I can see I have the right patients, the right medication, given the right route at the right time and at the right dose. That is it. That is 5. Okay, and then another thing you are going to do that is going to be a fail if you did not code well. When it comes to allergy, which is code 10, you are going to write it under that medication prescription chart where we see co-amoxiclav or any medication that your patient is allergic to. You put code 10 there. And then coming to where to omitted medication, you are going to write patient is allergic to penicillin, full stop. Okay, then you know this our patient is also, we have the one of incomplete medication, which is lansoprazole. Is incomplete medication because there's no prescriber signature and bib number. Now is also incomplete medication. Write it under your omitted medication because it's due on your time. You did not administer this medication. You are going to write it under omitted medication. Then under time of giving, you write not given. The code you are going to use is code 6. Is incomplete. You did not give it. Okay? Then there's the one we open as required medication. You don't need to code it. Yes. You don't need to code that one because start date is not there, which is necessary. There's no start date on that as required medication. It's when you give it, you're not going to write your own dates. That is the day you started this medication. You don't need to code it. Yes. Okay? You can see how I explained that particular side to the assessor. I'm not administering this medication. There's no start date, which is normal, and then I'm not licensed already to administer this medication because it's under 2 nursing procedure. 2 nurses are going to look at that pack of the medicine. This person will bring it out and then they count it and know the amount that is remaining is correct, and both of them are going to sign together. Licensed nurse. So I am not licensed. I did not administer it, and also I have also dispensed paracetamol. That is it. Just continue practicing, guys. If you have any question, please don't hesitate to chat. Comment under the comment section. I need help, Nurse Gold. I am happy to help out. Ask your questions. I am happy to answer you. Please keep practicing. OSCE is doable. OSCE is simple. You can do it. It's actually very simple. And I believe that nurses are smart, they are intelligent, they are brilliant. Alright? So guys, still remember to comment, like, and share. Go Chooks, love you all. Bye.